today. We are extremely excited to have Emily Kauffman from the United Way of Delaware talking to us about a new data platform of publicly available data, which we always like, which goal is to help communities, researchers, and policymakers understand and promote racial equity and social justice. All very relevant topic for our department, the Institute for Research on Equity and Community Health, Christian Acker, and the ACCEL CTR. So Emily is project manager for the Equity Counts Data Center and Partnership Initiatives at the United Way of Delaware. She grew up in Delaware and is completing a Master of Public Health at George Washington University. Before we begin, let me mention some housekeeping issues. As you know, we provide CME credits for our ID series presentations. We will distribute the information via email to those that registered for today's event, and you can obtain the information from Deborah Rees at Christian Acker. She will write her email address in the chat box. Our next tech talk will be more of a workshop, and that will be from Daryl Wansien at Delaware State University, who will explain to us how to do dashboards in Excel. And then we have an ID series on April 27th, and it's Janet Abers from Drexel, who will talk about population screening for lung cancer using low-dose CT, a decade of promises and pitfalls. And finally, and please, very important, very, very important event, we on May 8th, we have the Community Research Exchange, which will be an in-person meeting at Delaware State University, and where we have really a great lineup of speakers. That will be in the morning of May 8th. So, without further ado, thank you so much, Emily, for presenting this new data platform today to our community of researchers.
Yes, absolutely. I'm really happy to be here with all of you. So I'm going to share my screen in a moment, but before I get started, I just wanted to kind of set the foundation for the presentation that I'm going to do today. So if at any time you have a question or a comment, feel free to leave it in the chat. You can also raise your hand, and Claudine or Deborah will flag it for me because I'll be sharing my screen, so I won't be able to see the wonderful comments that you're making in the chat. But I wanted to make this a discussion, so your feedback and your comments and questions are very, very much appreciated. So thank you so much, and I will share my screen. Can you all see that?
Yes, we can.
Yes?
Yes.
Great. So I'm going to talk today about the Equity Counts Data Center, and more specifically, the project that I've been working on, the Equity Counts Partnership Initiative, which speaks to building data capacity with community-based organizations in Delaware. My name's Emily Kauffman, and I've been working on this project since August of 2022. So first I'm going to talk about the Equity Counts Data Center, which is the new platform where you can go in, and anyone who's interested in this sort of data can go and see this data that's available at the demographic level, which I'll speak to a little bit more about later. And I wanted to talk about how the Equity Counts Data Center was created, because it was a process, a collaborative effort from multiple organizations, and really the thoughts and the frameworks that went into creating this data platform. And so it was collaboratively designed with the Delaware Department of Public Health, the United Way of Delaware, the Delaware Racial Justice Collaborative, or DRJC, and then Green River, who is a software development company based in Vermont, who are pivotal to this work because we need software developers that can actually build and create this aggregator of different web platform of different data centers, or different data sources rather. And so the United Way of Delaware, the Division of Public Health, and Delaware Racial Justice Collaborative really met minds and recognized that there was a need for a platform like the Equity Counts Data Center to exist. And then in speaking to the frameworks that we built the data center off of, it was really created from this framework, this visual that you see in front of you, which was developed by public health researchers at the University of Wisconsin. And they basically determined that health outcomes, which is essentially length of life and quality of life, so how long you live, but also the quality of those years that you are alive. Those can be attributed to health behaviors, clinical care, social and economic factors, and also the physical environment. So health behaviors that's speaking to one's individual actions that they really have control over. So whether they're eating their vegetables, whether they're getting physical activity throughout the day. So that's about 30% of health outcomes. Next is clinical care, which is about 20%. So access to care, quality of care. And then the bottom two factors are social and economic factors, which speaks to one's education level, the employment options they have and where they're employed, income, family and social support. So do you have people around you that are positive and that you feel supported by, and then how safe you feel in your community. And then 10% is physical environment, so the quality of air and water that you're ingesting and taking in, and then also housing and transit. So the physical house that you live and what your mode of transportation is, whether it's car, public transportation, walking or biking. So one's health outcomes is basically a combination of all of those factors, and the social and economic factors and physical environment can be traced back to where a person lives or their zip code. And so in thinking about zip code, it's really important when we're looking at data to think about the geographic level that we're looking at. And so in the creation of the Equity Counts Data Center, it was really important to those organizations to get zip code level data, because we know that different zip codes across Delaware might be experiencing different social and economic factors overall, or different experiences of their physical environment. And so, so this was a really, really important framework in the social determinants of health, and also a really interesting graphic and framework that you can go back to over and over again and get more insights and knowledge from. And so essentially when we're talking about social determinants of health, which seems like a buzzword where we mention it, but what does it actually mean? And it's essentially our health and well-being is affected by where we live, work, learn, play, worship, and age. And that's not to say that one's individual actions or the quality of care or access to care are not important. It's not an either or, it's a both and. Again, all of those factors play a role in someone's health outcomes. But we can't ignore these simple things of how educated someone is, or are they getting access to quality education, or what is their income level, how safe do they feel? So all of these things really matter, and it's important to quantify it or measure it. And that brings us into the Equity Counts Data Center. Again, the United Way of Delaware, the Delaware Division of Public Health, and the Delaware Racial Justice Collaborative identified that it's really challenging for decision makers and the people that are designing these programs to address issues in the community. It's really hard to gather data that's specific to it, or specific to the area that you're trying to focus in on. There's no central place to find this detailed data relating to social determinants of health, or maybe you have to go into different places. So go to the Department of Education website, go to the public health website, go to the census website. So you have to go to all of these places, which can be really time consuming, and you have to have knowledge of how those data sources work. And so it was basically challenging to get easy access to data like this. And so the Equity Counts Data Center attempted and is attempting to continue to fill that gap by providing local and detailed data, an easy to use platform, something that when all of this data exists together, it tells a story. You can kind of put pieces together. It's user friendly for the stakeholders or in the community that uses it, and that ideally it would be continued to be developed and improved upon for long-term sustainability. Do we have any questions so far?
No, not so far. No questions that I can see.
Okay. And so the Equity Counts Data Center, what is on it? Essentially, there are the different categories of health, education, criminal justice, and wealth creation. And here you'll see the link to the Equity Counts Data Center, and it lives on the Department of Health's My Healthy Community platform. So if you're aware of that public health tracking network, there's many other wonderful sources of public health information and data there. And the Equity Counts Data Center is one portion or a subsection of the My Healthy Community platform. So if you're thinking about where the Equity Counts Data Center sits or how it relates to My Healthy Community, if you're familiar with that website, My Healthy Community is kind of the umbrella, the parent, and then the Equity Counts Data Center is kind of like the child, in one section of the website. And so next we're going to go into, there we go, more details about the data that we have in each section. So in health, preventative health, chronic diseases and health outcomes, adverse childhood experiences, which I think is a really unique and special piece of data that we have gotten from the Delaware Student Survey, and then COVID-19 statistics. For education, we have student suspensions and expulsions, performance assessments, so both math and ELA at 3rd grade, 8th grade, and again at 11th grade, and then enrollment and graduation rates. For criminal justice, we have student risk factors at the moment. So what percentage of students are carrying a weapon to school, or one indicator that is, I think, very insightful is what percentage of students have a parent that is incarcerated. And I think there's one zip code I can think of where 20% or 1 in 5 students have a parent that's incarcerated, which I think is very illuminating. And then for wealth creation, we have indicators that speak to employment, income and poverty, housing, benefits such as SNAP benefits, and area deprivation index, which is a measure that combines a number of wealth creation indicators that essentially determines how deprived or low resourced an area is on a scale from 1, which is the most resourced, to 10, which is the least resourced. You can get a sense of Delaware as a whole by this area deprivation index. And so the Equity Counts Data Center, it has these data sources from a number of state and federal sources all in one place. And I have a list of most of them. So the Behavioral Risk Factor Surveillance Survey system, surveillance system, which is a federal survey, the CDC Places Small Area Estimates for Health Indicators resource, the Delaware Department of Education, the Delaware School Survey from the University of Delaware, the University of Wisconsin put together the Area Deprivation Index that I was just speaking about, and then the American Community Survey from the United States Census Bureau and the decennial census as well. So it's unique and special in that it pulls together all of these sources that are specific for Delaware. And so why is this kind of data important? Well, it tells a story around equity in the population. And not only does the Equity Counts Data Center have data specific to zip codes across Delaware, but also within those zip codes, you can see where the data is available, differences by subgroup. So you can disaggregate the data and look at the differences by race, ethnicity, age, or gender. So, and we know that there can be differences based on those subgroups, even if they do live in the same geographic area. So you're able to get at that very specific level, and it can inform decision-making, the allocation of resources. So this takes me into working with the community-based organizations and grant writing and advocacy. So access to this data is very, very important to pull from to see where these gaps exist. Because if you don't know or have concrete evidence that there's a gap or there's a problem, then you can't come up with a solution and start to solve for those gaps. And then you can also track changes over time at the population level. And so next, I'm going to just show you some screenshots. So we're not going to go into the Equity Counts Data Center website today, but I'm going to show you through the next few slides how one might go into specific zip codes and start to play around with the data that's available. And I think that in this specific example, I have more questions about the data that I'm finding than answers, and then that will lead me into the data process that I'm going through with community-based organizations. So I chose to explore the zip code 19901. It's in central Delaware, Kent County, the eastern half of Dover. It has a population of 37,000, population density of 466 people per square mile, which is about the Delaware average. It's much less dense than a zip code in Newcastle County or somewhere around Wilmington or in Wilmington. And it's quite a diverse zip code, so 56% white, 34% black, 4% two or more races, 3% Asian, 2% other race, and 92% non-Hispanic and 8% Hispanic. And so I was interested in looking at wealth creation, the unemployment and poverty data that we had available. And when I first chose this zip code, I didn't know much about it, but I saw this heat map, which there's these heat maps, which I think is one of the coolest aspects of the Equity Counts Data Center, where you can easily see the differences across zip codes. So, and this data is from 2020, it's the unemployment rate, and this zip code was the darker shade of blue, which means it had a higher unemployment rate than the Delaware state average. In 2022, or 2020, excuse me, it was 8.3%. And then if we were on this website, where you can click on that button that says go to report and then see the data on a more granular level. So that's what I did next. So then I looked at unemployment rate by ethnicity, and this is where the data can get really cool and interesting, but you can see that not all groups are the same. So simply by filtering out by Hispanic and non-Hispanic, you can see that the Hispanic unemployment rate was twice as high as the non-Hispanic group, and it has been over time. And again, you can run more specific statistical analyses, but if you're someone who doesn't have the epidemiological background or statistics background that many of you have, this is an easy way to show these differences. And these graphs, like the one that I'm showing you right here, they're taken directly from the Equity Counts Data Center. So then I wanted to look at the unemployment rate by age, where again, you can see that see differences between groups. And you could see that in this zip code, 20 to 24-year-olds saw the largest increase in unemployment rate from out of any other age group from 2019 to 2020. And we know what happened in 2020. So we can again start to, I ask more questions. This is interesting. So why did this happen? And we know what happened in 2020. But if you're again kind of looking at the impact of the pandemic, this is a really interesting data point to look more into. And then I wanted to look at poverty rates. So I looked at family and child poverty rate in the zip code, and in both cases, they were higher than the Delaware state average. And then if you took the data and broke it down by race, you can see the differences, and that in the zip code, Black children, 50% of Black children in the zip code are living in poverty compared to 18.2% of white children. And so that's a very large difference. And again, something that illuminates the disparities even within the zip code. So there's a disparity between the Delaware average and the zip code, but then if you look who in the zip code are most affected by these social factors. And I think we're getting close to the end of my examples here. And so I broke it down, broke family and child poverty down by ethnicity. And I found this interesting, that there was still a gap between Hispanic and non-Hispanic populations, but there was this decline in family and child poverty rate in the Hispanic group that we did not see in the non-Hispanic group. So that was encouraging. And again, I have more questions as to what happened from 2019 to 2020 and 2018 to 2020 that impacted the Hispanic group, which didn't really affect the non-Hispanic group. And so, but interesting, and we wouldn't have captured this information if we didn't break it down. Oh, there's one more. And then I also wanted to look at health insurance rates by ethnicity and race. And again, you can see the differences. So Hispanics are less likely to be insured, as well as the Asian population in this zip code as well, and Native American. Does anyone have any questions about these examples?
So we have one question from Lian Tangji. How was the poverty defined?
Well, it was taken from the U.S. Census website, so it would be how they would their criteria for defining poverty. I hope that helps, but I would have to look at their specific definition, which I know that there are multiple.
Yeah, the census, all this information is on the census. If you took the census information, it's there is a definition for rate of poverty, which I don't remember also.
Yeah, it's below the poverty, at or below the federal poverty limit or threshold. Any other questions?
Well, I have a couple of questions, but I may also wait. It's up to you. Maybe you'll answer.
You can answer now.
So,
you can ask now.
All right. So my first question is, how is the linkage between all this data done? Is it at the individual level? So do you link each data set individually, for each person living in this zip code or, in Delaware? Or is it like at the group level? I have a hard time to understand how the linkage, between all this data is done.
Right. Yeah, and that's important. So it's all at the population level. There are no individual indicators. And so there's challenges with this level of data as well, because if one produces a program and there are changes in this population level data, and we can't attribute these changes directly to the program. This is more for overall needs assessment and looking at the population at large. And so there are challenges then with privacy when the population is so small, and that we can't put in a public place the data because it essentially is a privacy concern.
So the population is defined then at the census tract level, or just at the zip code?
At the zip code or census tract. Right now we have at the zip code level.
Okay. And the second question, I see here you have data from 2020. So what is the latest set of data that we would have, going on this data set? Is it always 1 year or a couple of years later, or how not accurate?
How often is it updated?
Yeah, right.
Yeah, that's another good question. So a lot of the data that we have is from 2020. I know that the census has released their 2021 data, and so we're working to update our website as well. So it's essentially as these data sets update their data, then we can then input the data that we have on the Equity Counts Data Center. And so there is a little bit of a lag time, and the different data sets update at different rates. So the Department of Education data, we might get that more often than the United States Census data.
So the lag time is about 1 year or 2 years?
I would say 2 years, in that I have been seeing for some of our data sets, we're getting the 2021. So hopefully within the next year, we'll get 2022.
Right, thank you.
So now I'll go into talking about how we're using this data, and this is the Equity Counts Partnership Initiative, where I've been working with these community-based organizations for how best to use this data. And so at the very beginning of this process, I laid out sort of how we would go about using this data, and sort of inspired or informed by organizations and groups that have these procedures for working with data. And many of them call it the data life cycle, where at the beginning you're planning and designing or formulating your evaluation questions, what specifically you want to know about or find answers to, and then going out and collecting that data and creating a source or place to store all of that data. And so that's what we did in finding an Excel spreadsheet or whatever form is best to grab the data that we want and then store it somewhere, cite it, make sure that it's in a form that we can transform it if we need. And then once we have all of the data together, we can begin to draw comparisons or start to process and analyze it. So moving things around, discovering insights, or in a lot of ways, once we look at the data, we have more questions. So we go back to the planning and designing, or we find that there's gaps in knowledge. So we have to go back to figuring out if and how we would be able to collect more data that would help us better answer our questions. And then at the end, it's the process of putting all of that data together, putting it into a form, visuals or descriptions that we can publish and report findings. And it's a very iterative process. So I began this process back in October with our groups. So I'm about halfway through our 10-month process. At the beginning of March was the beginning of the second 5 months of the process. And so right now it's pretty messy. We're kind of in the middle. I would say that with most of the organizations, we're going back and forth between processing and analyzing, and then kind of looking at everything and then saying, oh, wait, I want to learn more or see what data is available about business vacancies, for example. So then back to the drawing board and looking at, even outside of the Equity Counts Data Center, what other data exists out there or data sets that we can draw from to put together more of the pieces of the puzzle. And then hopefully we can put it together and package it and come up with really beautiful and interesting insights. And so that's essentially the process that we're going through. And here's who I'm working with. So I'm working with 6 organizations, and they're all different. They're all based in Delaware and working with Delaware communities. They're quite diverse in size. So we have large organizations who work across Delaware, so in all 3 counties. They have multiple programming, different departments within their organization that maybe focus on slightly different missions. And then we have smaller grassroots organizations that are maybe just getting started or created in the last few years, and they're really focused on one mission and focusing on changing that one thing. And so it's been very interesting to work with these multiple organizations to see how they function and how they approach data. So 4 of the organizations are in Newcastle County, and 2 are in Kent and Sussex. And there's a mix of these missions, but all address the social determinants of health. And so we have quite a few that are focused on place-based wealth creation. So looking at small businesses and looking at the wealth of the community and how to best build wealth. There's some that look at the youth risk factors, so they work directly with youth and what are they exposed to. Again, and it's been interesting because we started in with one group, we've thought about, okay, who are their parents and sort of what's the generational influence of what the parents have been exposed to and what's maybe passed down to their child and what they've experienced from when they were very young to when they grow up and then become parents themselves. Thinking about education. So where are the students going to school? What are they exposed to in their schools? How well are the schools preparing them for their next stage in life? And then health. So this conversation started with health and health outcomes. And it's interesting that only one of the organizations really focuses directly on health outcomes. But many of the others, they're essentially talking about health in social determinants of health, but not explicitly stating health, or we want to look at, or we're interested in diabetes, for example, or high blood pressure, hypertension. So it's been interesting to work with these different organizations that are focused in different areas, lasering in on different communities in Delaware that are also attempting to solve issues at different angles of social determinants of health, of those 4 main pillars of wealth creation, criminal justice, education, and health.
Emily, we have a question in the chat, if I may.
Yes.
So from John, do you find that there is good correlation from what is in the dataset to what is reality? I know some poor people do not consider themselves poor or report as poor.
Yeah, and that's really interesting. And that's kind of marrying the quantitative data that's in the Equity Counts Data Center with a qualitative data set. And we haven't gotten there with the work that I've done in capturing qualitative data to see if there's a matching of what we're seeing in a community versus what they're experiencing, or even that ability to capture assets in the community. So, which I think can really be captured through qualitative data. But I think that you bring up a good point in that it's not either quantitative data or qualitative. It's really both that tells a complete story.
Right. And I have another question also. When you talk about the organizations and these missions, do these organizations bring data, or do they bring the ideas of, what data to collect, or what do they want to analyze?
Yeah, it's interesting also going in, because one of the first things that we talk about in that planning stage is one of the questions that I ask them is, what are you working with data, and what data is your organization collecting? And I would say that there's a range of kind of levels of whether the organization works with data or really does not. So maybe the organization has existed for years and years and years, but they really don't have a data process, or their data capacity is somewhat limited. And so they have these programs, they know they're needed, but they're really only using the data when they quickly have to write a grant, but they're not using the data to develop their programs or look at the programs that they have and assessing whether they're implemented in the right areas or not. Whereas there's some organizations where there's one organization in particular that I'm working with where they have a set data person on their team that captures both their programmatic data outputs. So we've done this many projects with this many groups. So sort of like capturing those numbers and then doing surveys and outcome data. But then also looking at this larger population data. So again, I would say there was a mix of data capacity, and that's what I'll kind of talk about in my challenges section next. But before I move on, does anyone have any other questions?
No, but I would just add a comment, and I think related to John's question a few minutes ago. I guess the beauty of this data, so you are presenting quantitative data, but that can trigger, more research using qualitative data to really understand, these correlations that John is talking about.
Right, absolutely. Yes, so as I said before, I'm about halfway through this process from identifying what our evaluation questions are to completing and delivering a final piece of work that will kind of describe what our findings are. And then really what that means for the organization, because it all goes back to what the organization is attempting to solve for. But the challenges that we've experienced is time and limited organizational capacity. And so, the community-based organizations, nonprofits, they're pulled in many, many different directions, wearing many different hats. And a lot of this work is different than the day-to-day grind. So it's a nice long process where the time that I have with them, we can stop and think. But it also requires the organizations or the people that I'm working with to zoom out from the day-to-day operations and think about their overall organizational mission and what the organization is doing to solve this issue. And there are conversations about their theory of change or their logic models, and that's what they're doing, what are their programs, and how are they logically intended to change these outcomes by producing these outputs. And so some organizations have a logic model in place or that theory of change, and some of them haven't really taken the time to think through that process. And then as we're kind of thinking through those programs, we can pull out these indicators or data that might be relevant to answering some sort of intermediate a part of the process in that theory of change, rather than just looking at that final outcome of childhood literacy or third grade reading level. So in talking and back to challenges and just the difference in how we're talking and thinking through this process can be very different than their day-to-day work. And sometimes that day-to-day work, and in most times that takes the priority over this sort of project. And then there's also limitations with the data. So it is this population data, and the data that we have is only as good as the data sources. And so at times, we can't get the data at the disaggregated level or at that granularity that we want because, again, the population is so low, or it was redacted for whatever reason, and so we don't have all the entire scope of the data that in an ideal perfect world we would have. And then again, there's this thing that always comes up with working with organizations in that we cannot prove that your organization works or that the program that you're implementing is producing this change by using this data. And then continued monitoring. So I was thinking about this more so in that after this program ends, how are these organizations going to continue to work in this way without my assistance? And is this going to produce long-term change? And I haven't evaluated or assessed that process of continued monitoring, but it's something that's on my radar, and thinking about how these organizations can carry on this work after this project ends, and how can they maintain their own data set and go back to the Equity Counts Data Center or similar data sources to continue to have this data mined about the work that they do. Any other questions?
So I have another question. You mentioned that your work is going to end in July 2023, right?
Yes.
So, but will the Equity Data Center continue, or is it, I mean, we won't have any other updates of all the data?
No, it will continue on. As far as we know right now, the plan is for the data that we have to continue to be updated on an annual basis, and should be continue to be available for anyone who wants to log in. So there's no, you don't need to create an account or pay anything to use or access that data. So it should be publicly available for years to come.
There are no other questions at this point.
Great questions. And so our goals by July 2023, when this project ends, is that I'm enhancing the team's capacity through the use of Equity Counts Data Center, but also looking at what other data is out there. And again, zooming out and thinking about their organization in this way that's data focused. Part of this work is informing the development of Equity Counts Data Center. So we're using the data center and defining and determining where there might be improvements that need to be made, or that there's data sets that we really need and that a lot of organizations are asking for that aren't currently in the Equity Counts Data Center, but we want to be. So we're working on a phase 2 right now, and I don't have a timeline for you, but I will say that it's in the works to get more data on the platform, hopefully to come soon, but I don't have a specific time yet. And then bolster data use to inform the resource allocation, policy proposals, program implementations, and community action initiatives. Again, rather than just saying, you know, this problem that I'm seeing in the community, or I'm aware of, we need to solve that by producing this program, having the data to back up and support what the organizations are trying to do. And then to sum it up, promote change. So to produce these solutions through data that tells a story about the organization's need. It exists for a reason, and the reason is this, and the impact that it could have in Delaware. Again, we can't identify solutions if we can't see objectively the problems or the gaps. And so I think that brings me to the end of what I wanted to share, and I will open it up for final questions. And here are my resources. If anyone's curious about that county health rankings model of health outcomes and sort of what their methods were, I can send you the link to their methods.
Any question for Emily? Please feel free to unmute yourself and ask a question, or bring the question in the chat. Gwen?
Hi. I've been working closely with Emily on the Equity Counts Data Center since it was just a thought on paper, and she's done a great job today, kind of helping tell the story of what we've been trying to accomplish. But I want to kind of reiterate the point that the Equity Counts Data Center is not going anywhere. It is a permanent part of the platform, of the My Healthy Community platform. The Division of Public Health is very committed to addressing the issues of equity through, population health solutions, if you will. So that commitment remains, and we hope over time, as resources permit, we'll be able to add more indicators, because we have a whole list of indicators in these areas that we would like to see, on the site. So we're working closely with public health to get those added. So over time, the center continues to grow, to become more robust. As issues develop across the state, where having a particular indicator on that site would help illuminate the issue and provide a platform for people to develop solutions, we will continue to address this. So this is a living, breathing center, if you will. And our thought about presenting today was that we really want to encourage researchers, especially those that are really trying to strengthen that linkage from bench to community, and community to bench, if you will, that they will see this as a resource, and then they'll offer us ideas and feedback about how, what their user experience has been like. Because through that feedback, it gives us an opportunity to continuously improve the quality, the responsiveness, the ease of use of that site. So we appreciate this opportunity today.
Oh, that's great. Thank you. This is a wonderful tool, I think, for a lot of people and for many of us. And in fact, I have multiple questions, but one, is it possible to download the data sets so that people can work on, specific data on their computer? Or is it only through the queries, the website queries?
There is a way that you can download the data. So in each data section where the graphics appear, there's a little blue text where it says about the data. So you can click on that and it'll take you to a separate page where it talks about where the data comes from. And then below that, you can download the data, and you can download it at the state or zip code level, and in some cases census as well. And so you can download the raw data sets to analyze and manipulate on your own, which is great, and
that's
a huge
great.
Time saver that you don't have to copy and paste every single piece of data. And also you can get disaggregated data that you might not be able to see in the graphic presentations, but you can get that disaggregated data in those raw data sets.
Great. I'm sure lots of people would be interested by this. Pragyan, do you have a question?
Yeah. Well, you answered one of my questions about if there was a data dictionary, or I was just about to ask if there's a data dictionary or metadata available for some of the specific measures that are included. But I have another question as well. But first, great presentation. I know it's a huge undertaking, aggregating all these different data from a variety of different sources. I was wondering about the area deprivation index variable. From what I know, it's usually provided at the block group level. And I was wondering, since a lot of times, like block group levels in census tracts don't always align with zip code boundaries, what was the aggregation process like for creating the ADI at the zip code level?
Yeah, that's a really excellent question. And honestly, I don't know what that process was like. I would have to refer back to the developers. But that's really interesting because, yeah, and I know that the block group into zip code don't automatically align. And I would have to go back to the source, which I have here, to look at their methods of how they did it, because I believe on their website they put it together by zip code. And I just posted the link in the chat. But yeah, that's a good question, and I'll look into that myself.
Sounds good. Thanks.
Here's a question.
Okay.
Thanks, Emily. This is my first time for participating on this, so forgive this question if it's going to sound a little selfish of me, but from a disability perspective, because that's the arena I'm in, I'm out on the My Healthy community right now. I don't really see where there is that sector group. Am I missing something, or is it integrated in with the other information where it's focused on the disability population within the subsectors, if you would?
Yeah, that is a great point. And right now, as far as I know, we don't have any of the data disaggregated by disability level. An area where I'm thinking that we could potentially integrate it if we wanted to go in that direction is in the education department. I know that they have, for instance, assessment data disaggregated by disability. So again, the data that we have is as good as the data sets or the level of detail that they have created. So I think, as far as I know, the category that we could potentially do that is definitely in education. I'd have to look at the other data sets to see if they disaggregate by disability or how you would define disability. But that's an interesting point.
One of the things that I'll just share is when you have a person like a funder, they're looking for that data set of zip codes and how many people are in the what we would call the poverty level mean of because most people with a disability are on Medicaid. It's a presumption, but having data that sort of backs that up is always more beneficial when you're doing that kind of information. So it's just a question for me, but thank you. It was a great presentation. I really enjoyed it.
Gwen?
Yeah, if I could just add to it, we really appreciate that feedback, Beth. And that's the kind of information that we are funneling back to this development process. We can take that information back to the Division of Public Health and say, this has come up, in our travels, so to speak. And so that feedback continues to help us to make that whole platform as responsive as it can be to meeting the needs, of the users that will be taking advantage of it. So thank you.
Well, unfortunately, thank you so much. Unfortunately, it's already 1, so we have to end, but this was really, really interesting. Thank you so much, Emily. Thank you so much, Glenn. And, we are